Our next case is Jerry. His diagnosis is lymphoma of the brain. He presented with a headache and on his examination had evidence of increased intracranial pressure. Jerry, when did you first develop headaches?
I first started experiencing the headaches in late April, and it continued on into May for a period of about 2 to 3 weeks before I sought medical attention.
Where were the headaches located mostly?
Well, they were centrally located. Most of the pain was pretty much in the temple area, but you know, with the headache, it just felt like it was coming from every place.
Did you have other symptoms?
I had some dizziness, fell a couple of times, and I had a tendency when I was walking or driving to list to the left side. If I was walking, I'd find myself having to prop myself up against the left wall to keep from staggering or falling. And once when I was driving, I happened to venture over too far toward the center and actually struck the center median with the left tire of my car. Then I figured it was time to go get some medical help.
Okay. When did I first see you?
You first saw me on May the 9th of 2001.
And when I examined you, your examination was normal except for your eyes. And if you recall, you had swollen eyes. That is to say, you had papilledema. The back parts of the eyes were swollen. And that was the only physical finding that you had at the time. You had no weakness, you had no numbness, you had no trouble walking. Before you saw me, did you see any other doctors?
Yes, I went to my regular family physician because I couldn't get the headaches to go away or dissipate using standard over-the-counter medications like Tylenol and aspirin. My first visit, they thought that perhaps it was allergy related, so they sent me home with a bottle of Flonase. 2 days later, that wasn't doing any good, and I went back to them for a follow-up appointment, at which time they felt that there might be something more severe, and that's when they referred me to you.
What test did we run on you?
Well, let's see, I believe I had a CAT scan of the brain followed by an MRI.
And what did those studies show?
Well, it's my understanding that the CAT scan actually indicated that there was a swelling of the brain which was causing the pressure to create the headaches, and that the subsequent MRI actually revealed the presence of a centralized tumor.
So we diagnosed that you had a tumor of the brain by the MRI and the CT scan of the brain. Then what did we do?
That's correct. Well, following that, I was referred to MD Anderson because of the location of the tumor.
What did they do at MD Anderson Hospital?
Well, I underwent a cranial biopsy at MD Anderson, followed by analysis of MRIs and CAT scans.
Okay, what did they find?
They interpreted the results as being a lymphoma of the brain.
What did they do once they diagnosed lymphoma?
Well, they ordered chemotherapy.
Chemotherapy. What was the name of the drug? Do you remember?
Methotrexate.
Have you had any other treatments besides methotrexate?
No.
You have not had radiotherapy, correct?
No.
How have you done since you started with all the methotrexate?
I had some pretty adverse side effects from the initial chemotherapy. I developed pneumonia as a side effect, and because of that pneumonia, I spent some additional time in the hospital trying to recover from that. And my chemotherapy sessions have actually been postponed. It's going on, I guess, the third full month, so almost 90 days have elapsed just trying to allow my lungs to recover because of the side effects of methotrexate on the lungs.
Are your headaches better now?
I haven't had a headache since you diagnosed me in the hospital and put me on the steroids.
Have you had any MRIs since all this began after the initial diagnostic one?
Yes, I had a number of them. In fact, the last couple of MRIs that I've had have shown no traces of the tumor. It seems to have been reduced to nothing.